So, good morning. Today is the first in a series of talks that will help us understand this earth suit, this body that we arrived in, that we take care of to the best of our ability. But it turns out that in our primary education and our secondary education, in this country and in most countries, we don't learn about the most obvious thing in the world that we can call ours, and that's this body. And instead we allow a group of people, which we treat as elite, called physicians, to learn about the body. And so when something goes wrong, we take it in just like we take in our car. We say, hey, doc, can you fix it? Fix it. And it doesn't have to be that way. So, hopefully, this series will allow you to understand your body enough that you can be your own physician. And there's no reason why you can't be your own physician. So basically what I'm going to start talking to you about is anatomy and physiology. They go together. Anatomy is form, shape, and physiology is function. Right? So, I mean, think of a screw. You know, a screw's got a wide flat end with either a single division or double division, and then it's got a thin cylindrical piece of metal, or whatever it's made of, and a spiral. What are you going to do with it? Screw it. And that's the only thing you can do with it. But so form is function. We have to understand that. Very, very important. In fact, you cannot even separate them, really. They have no separation. Unless you're talking about a cadaver. If you're talking about a cadaver, then you've got form, no function. But otherwise, in living beings, form is function. A butterfly's wings are not there just to be pretty. They do, just like a bat's wing. Everything has function. So anatomy and physiology. So I want to give an overview of anatomy and physiology, and to stay on track, I make some notes. Okay, so anatomy. Remember, description of form. And the reason it's so important to understand this is because when you think of, let's look at different professions. Why is it when we go into a courtroom or we go to a lawyer, it's above our heads? Well, it's only above our heads if we don't understand the language. Language is what separates people. Language is what separates us from beasts. It's language. Okay, and so each profession has its own jargon, they call it, but it's language. So if you speak that language, you can talk to them. You understand what they're saying. You can communicate. Okay, so what I want to do is give you some language so that when you so that you understand when you hear doctors talking about it, or you can ask questions. Just like if you have anyone who's had enough attorneys in their lives for corporate or whatever they go through, start to learn their jargon and are able to talk to them more clearly. Advertising, computer, a mechanic. It doesn't matter what. Every profession, every group has what sets it apart. What makes it unique is this language. What separates people when we look at class systems of people, and we look at the workers versus the people that manage the workers, is language. If your language is of a certain caliber, you will climb. It's just the way it is. So language is all of that. So anyway, anatomy, form. There's two types. It can be divided into two. Gross anatomy, which is a view of things as they appear from our perspective. And then there's microanatomy, which has to be viewed with a microscope. Okay, so we're talking about structure. So, structure with the naked eye is gross anatomy, and structure with a microscope is microscopic anatomy. Microscopic anatomy has two divisions. And you can either look at the smallest unit of life called a cell, and that's called cytology. C-Y-T-O-L-O-G-Y. Cytology. Or you can look at groups of cells that function similarly, and that's called tissue. It's tissue, and we call that histology. So, to give this some relevance, when they do a biopsy on a breast, or they're doing a surgery and they take out a piece of tissue from a mass or something that's suspicious, and they take it and they send it off to the pathologist. What the pathologist does is he slices it down and he looks at the tissue. So it's called a histological diagnosis. Okay. Histology. Now, these are amazing. Okay, now with gross anatomy, we can look at it at either regional, systemic, or surface. Regional gross anatomy, right? The anatomy that you see with your eye is obvious. What regions? There's a head, there's a neck, there's a torso, right? And then there's limbs. Okay, so those are the regions. And of course, within each of these major regions are all kinds of little regions, small regions. Like, it's clear that the torso has chest, abdomen, and pelvis. Even though we made up those words, we made up those names, there's no line except between the chest and the abdomen. There is a line. There's a diaphragm. The diaphragm does separate. Other than that, there's no line between the pelvis and the... Because the pelvis we think of as the urogenital system. But a lot of the colon is in there. So it's not just urogenital. And up here in the abdomen, of course it's behind in the back, are the kidneys, which are uro. So but that's just a distinction, okay? It's a gross distinction. And then there's surface anatomy. Surface anatomy is looking at the surface and being able to tell what's underneath it. Once you know, if you've studied anatomy, you know that you've studied what's underneath the skin, then by looking at the skin and I guess touching it and doing certain maneuvers, you can tell whether or not what's under it is in trouble. Like a liver shouldn't be, you should be able to should only be able to kind of just feel like a very thin, comes to a really thin, wide angled point. And so you shouldn't be able to feel it. So if you can feel under this rib, the spleen you shouldn't be able to feel at all. If you can feel the spleen, you can touch a spleen, it's enlarged. Things like that. So there's things that, okay, so that's that. So, remember, cytology is the study of cells, and histology is the study of tissues. And I want to talk about the units of organization. The most fundamental unit of organization that science has been able to discover is called an atom. And the most simplest atom is a proton and an electron. Should be proton, 2 electrons. And this is it's called hydrogen. And hydrogen is actually produced continuously from the sun. The sun is just pushing it out. The proton, the single proton, and electron, hydrogen, is the fundamental, most basic of all atoms. Okay? And by the way, a single proton is what we call acid. An acid, alkaline, we all talk about being alkaline and being acid. Okay? It's about protons. So when we talk about pH, the H is hydrogen. The H is the pH, looking at the level of acidity, is really based on hydrogen, and hydrogen is a proton. Okay, so the more single protons in a mixture, the more acidic it is. The more alkaline it is. Okay, and so the pH is the logarithmic scale of the concentration of hydrogen protons in a concentration. Okay, so that I just want to kind of correlate things. So anyway, that's what atoms are. And then you have atoms which are, they go all the way up. The periodic table has how many? The periodic table lists all the atoms. Number one is hydrogen, then you have helium, then you have lithium, and you have oxygen, and then they're grouped. These atoms are grouped. No, all they are is as you go up the scale, you go from an atom that has, and the simplest form of an atom is one proton, one electron. Then you get 2 protons, 2 electrons, 3 protons. And why do we have different names? Because now it has different properties. And the properties are based on really the number of electrons and whether or not they're paired and where they're shaped, where they're located. Okay, so also, when you get up into about 2 or 3 protons, you start to get what they call neutrons. Hydrogen doesn't have a neutron. What's a neutron? Neutral. Protons are positive, electrons are negative, so neutrons are neutral, and it's in there. I have to say something here. We talk about it as if there's an it. No one's ever seen an atom. You can't see an atom. It's impossible to view it. Okay, because they are so delicate that the very act, in order to see something, light has to bounce off something and then hit your retina. Okay, the light would scatter. So you cannot possibly see it. There might be another kind of technology which allows us to indirectly view it. So that, when we're talking about atoms, we're talking about them as things, just like we talk about light as if it were a thing, and we say that light is made of photons, so as if photons were particles, but they act like waves. So I just want you to know, when you get into atomic physics and trying to understand the world scientifically at an atomic level, there's a lot of stuff you have to accept before you can go on. But anyway, atoms getting together are molecules. And molecules are what is the basic fundamental thing that's going on in this universe. It's the way nature works. Okay? So a molecule can be, if you have 2 oxygen atoms together, you have O2, it's called oxygen. It's a molecule of oxygen. That's a very important function. Okay? If you have 2 hydrogens together, you have hydrogen gas. Okay? If you have a carbon and 2 oxygens, you've got CO2, which is what we exhale and what plants breathe in. Okay. Amino acids, fats, essential fatty acids. These are all molecules, and they vary in size and the number of atoms. Okay? So that's the next unit of organization. And then comes, in biological systems, then comes organelles. Organelles are little, like an organ, like the heart performs a certain function in the body. An organelle is a little, performs a certain function in a cell. So it's an organ of the cell. Okay, and there are many. In the cell you have a nucleus, and then you've got ribosomes, which produce proteins. You've got mitochondria, which produce energy. So there's all kinds of organelles. Okay, that's in biology, that's the next order of organization, the next level. And then finally, those organelles and that nucleus and the membrane become a cell. And the cell is considered the smallest unit that's alive. Why? Because there are single-cell organisms, amoebas. So it's the smallest unit. Now, when cells work together and have a similar function, it becomes tissue. Liver tissue, heart tissue. They have a similar function. Probably one of the greatest mysteries is, since every cell of our body has the same DNA, why is this one acting only like liver and this one's acting only like hair? You know, how's that happening? And that's the whole idea behind stem cell research. The whole idea behind stem cell research is that any cell in the body could actually become anything. But once it's committed to a certain pathway, all the other stuff is turned off. So if you can find a stem cell that's still uncommitted, you can get it to be whatever. So it's pretty neat. And where do stem cells come from? We make them all the time. They're being produced all the time. That's how our body heals. We're producing stem cells. We're producing new stem cells. So if you get involved with people that are providing that service, you know, probably the most common way is not embryonic, not cord, but more harvesting your own stem cells. Okay, now, and then, from tissues you get to an organ. And an organ is usually made of 2 tissues, maybe up to 4 tissues. Okay, and an organ performs a certain function. An organ is the liver, heart, kidneys. Now, not all organs are paired, clearly. Some are paired. And then what do we have? Then we have an organ system. And an organ system is the cardiovascular system. Okay, so the heart doesn't function alone. In fact, the heart couldn't function without the vessel. Because in order for the heart to function, it has to take a moment, relax, and get filled up with blood. Okay? And that's called diastole, when it's filling up with blood. And then it contracts. Okay? Imagine if you had a balloon with water in it, and you cut off the top, and you go, it would just... But if you've got something with some resistance, it'll... Okay. So it's the resistance of what the heart pushes against, the arteries. That resistance can open and close, will help define the flow. And that's called afterload in cardiology. You know, so a lot of times people have high blood pressure. What they do is they do some afterload reduction. They give drugs that reduce that resistance. Okay. But what also depends is when the blood comes into the heart and it's expanding during diastole, there has to be an adequate amount coming back in, because if it, you know, the cardiac muscle will contract. The strength with which it will contract depends on how wide it gets. Right? It gets more leverage. So you've got to fill it up, and that has to do with the veins. Okay, and that's called preload. So preload has to be adequate. If it's too much, it starts failing. Anyway, so it's the cardiovascular system. The gastrointestinal system, amazing. I mean, it starts with the mouth, ends at the anus, and in between you've got many organs involved. It's just an amazing system. You know, then you have the organism, because guess what? None of this... Again, we've divided them up as if the gastrointestinal system is isolated. Well, it needs blood. Yeah, it needs the immune system. It needs white blood cells running through there. In fact, most of the lymph tissue of the body is located in the gastrointestinal system. So you can't really divide it. These divisions make it easier for us to talk about and learn, right? But we have to get away from, you know, at some point you step away from looking at the body as a fragment and made up of all these different things, and realize that it's an unbelievably complex function. we talk about the endocrine system. Where's the endocrine system? Everywhere. Brain, thyroid, ovaries, adrenals. The heart has a hormone. I mean, endocrine is hormone. So, anyway. Now, I want to give you some words you can learn. The other thing is homeostasis. Everyone's heard the word homeostasis, right? Homeo means same. Stasis means not moving, static. Okay? So, homeostasis has been called the wisdom of the body. The same. What does it mean, the same? It means that the body, when the body is functioning, perfectly functioning, optimally functioning, the wisdom of the body, the homeostatic mechanisms are there to keep that happening. Okay? But remember, it's not just, the body's not just sitting there. There's all kinds of things. There's about 150,000 biochemical reactions going on every second. Very dynamic, incredible system. But there are external disturbances and internal. Right? So, wind, heat, a sword, a car. So, when all these things happen, the body has to adjust and all those homeostatic mechanisms to maintain optimal functioning of the organ. And when that is disturbed, when homeostasis is disturbed, is when what comes in to play are the repair mechanisms, the healing mechanisms. Okay? And how do we know when a healing mechanism has come in? Because we call it symptom. So a symptom is a message that the body is healing something. Okay. Of course, it's happening at a much more subtle level. There's a lot of healing going on that we don't know of. But once we do know of it, and the most fundamental way in which the body begins to heal is called inflammation. And inflammation we'll go over probably at another talk. But homeostasis is a very important thing to understand. And that's what nature is. In fact, nature will balance. You can count on it. It has to balance. Balance has to be. So, when the atmosphere, when the conditions in the atmosphere are achieve a certain temperature, you have temperature changes, you've got cloud formation, and all that. And these clouds are moving together. There's electricity that comes out of it, that's produced. It has to be grounded. It has to balance. And then we see lightning. So most of the time, homeostatic mechanisms are slow and occur over time, and sometimes they're like that. And I just bring up a little thing, is that the most common sign, first sign of heart disease in men, most common first sign in heart disease in men is sudden death. So, it's not, we call it sudden death, but just to let you know, what has happened is the person's homeostatic mechanisms have been working so hard. And once they don't work, then there's the failure. So homeostasis. Well, I don't know if we have time to do it all today, but I want to talk about connective tissue, the most abundant tissue in the body. Okay, and we've got the several types, and you have it in your thing. It's support, protection, binding, insulation, and transportation. Transportation, of course, is the blood vessels and the lymph vessels. But you have adipose tissue, which is fat, as part of the connective tissue. The areolar, which is the packing material. There's also the extracellular matrix. Bathes the cell. Very important. So when we get edema, when we get fluid buildup in our legs or anything like that, that's where it goes. It goes into there. And then there are other kinds of connective tissue, the dense ones like bone, cartilage, like you have in your ear and your nose. You have it along it connects rib to sternum. It connects a lot of things like muscle, blood, and lymph. I'm sorry, muscle's not considered, but the blood and the lymph are the last one. And so you think about it, the connective tissue is all of that that holds everything together, that allows it to work. Okay? And one of the things that vitamin C does, it does many, many things, is that vitamin C keeps the connective tissue healthy and repaired. So I'm sure everyone knows the word scurvy, which is vitamin C deficiency, and so that the American Dietetics Association has come up with what's called the recommended daily allowance, the RDA. I think it's 50 or 60 milligrams of vitamin C a day, which is just enough not to get scurvy. So really, it's just enough not to have a deficiency syndrome, but it has no concept of optimal requirements. What if I had just enough oxygen to sit? I couldn't get up and run, I couldn't get up and do anything. It's the same kind of idea. Okay. So, and what happens in scurvy? Think about it, what happens in scurvy. Their gums start to bleed, their skin gets it gets cracks, because what's happening is the connective tissue is not able to form. So without connective tissue, we would have really no shape to our face, and things wouldn't be held together and all that, and we wouldn't be able to transport blood. Actually, and the blood and lymph themselves are actually considered part of connective tissue. Okay, so it's really important. And then muscle. There are different types of muscle. There are different types of muscle. There's muscle that is voluntary, it's striated. There's muscle that is smooth, it's involuntary, so that's when your bladder contracts or your peristalsis. Blood vessels. When you stand up, your arteries have to constrict. Otherwise, all the blood goes to your foot and you fall over. In fact, that's what happens when someone stands up and they say they feel faint. It's because they didn't contract. It didn't contract quickly enough. Fortunately, that's not a voluntary. It doesn't require voluntary action. In fact, 99.9% of everything that happens to us is not voluntary. It's involuntary. Fortunately, if we had to think about it, we couldn't do it. You can think about breathing and reading your heart, secreting your now I'm going to digest. Quiet. We can't do that. So that's smooth muscle. Operates different, functions different, looks different, but it's still muscle. And then we have heart muscle, which is considered a third type, and it has components of both. Striated, voluntary, and involuntary. It's got components. Although heart muscle is not open to voluntary contraction, your heart rate can be controlled with biofeedback, which basically teaches you how to relax. Meditation does that. You slow your breathing, you slow your heart usually. It's the cardiopulmonary. Remember, when the heart's opening up in diastole and the blood coming from the lungs, it goes to two places. The blood comes into the right side of the heart, it's pumped up into the lungs, and it goes from the lungs to the left side of the heart and then to the body. So the lungs are part of it. That's why the stuff that goes back out to the body on the left side of the heart that's full of oxygen and got rid of it. It's a very important interplay of these two systems, respiratory and cardiac. So these glasses turn out not to be convenient. Now, one interesting thing about the heart muscle in and of it that distinguishes it from other is that it will contract or beat on its own. It's got a specific beat on its own. And in fact, ours beats faster than we want it to on its own. So we have part of the autonomic nervous system called the parasympathetic, which keeps it slower. That's why when someone gets a condition, such as an aberrant tract, electrical tract, and they find that their heartbeat goes up sometimes, like we call it PSVT or SVT, supraventricular tachycardia, or paroxysmal supraventricular tachycardia, just really means that once in a while the heart will go fast for no apparent reason, right? And there's no apparent reason, but there's always a reason. There's never a there's nothing random in the universe. So, that's why when that happens, the several ways that you can stop it are by stimulating that nerve, the vagal nerve, which goes to the heart to keep it in a slower, because remember the heart will normally beat faster. The muscle, intrinsic, I forget exactly how fast it would normally beat, but I think it might be 120 or something like that. I don't recall, but the parasympathetic keeps it down. So what happens when you get excited and you're going to run or you're afraid is, as your sympathetic gears up, the parasympathetic leaves off. So you don't even have to kick your sympathetic system into motion yet. As long as your parasympathetic wears off, you're going to have accelerated heart rate. So, how do you slow it down? You do things that stimulate your vagal nerve. How do you do that? What stimulates your vagal nerve? What stimulates your vagal nerves are parasympathetic. You've got to think of things that the parasympathetic system is working with. And I guess I jumped ahead and I didn't mean to. We're now talking about the autonomic nervous system. But the autonomic nervous system, that part of the nervous system that is not under conscious control, has two branches. One's called the sympathetic and one's called the parasympathetic. The sympathetic nervous system is the fight or flight. That's the one when, again, it's going to control all these involuntary muscles. That's the one when a guy's coming at you with a knife. Okay? What happens? Your eyes dilate, all the blood flow goes, you stop digesting, you stop doing all that stuff, not important right now, all that blood is diverted to muscles. Okay, and so that's what happens, right? And you're surged with energy. Now, when you feel that way, and there's no guy with a knife, you're having some trouble. And people feel like that in this artificial world a lot. We call that anxiety. Anxiety is low-level fear without a reason, without a purpose, and without an exogenous source. It's called free-floating anxiety. But anyway, the other part of the autonomic nervous system is the parasympathetic. The parasympathetic controls all of the restive, digestive systems. Keeps things slow and mellow. Keeps your digestion, all your glands secreting, all that is under parasympathetic control. So, what happens? What happens if you're always anxious? You're always on sympathetic overdrive. What happens, what suffers is your parasympathetic. You don't have good digestion. Inadequate digestion. You have inadequate, every aspect of it. Most of the urogenital system, all of it. So from urogenital, gastrointestinal, cardiovascular, endocrine, you know, every system is dependent on that. So if you're in sympathetic overdrive, you cannot have you cannot have good function of these other systems. I have to catch myself because we all grew up learning to think this is good, that's bad, this is good, that's bad, and we walk around judging all the time. And what I've learned is things aren't good or bad, they're just necessary, obviously. happening. He's allowing it to happen, so it must be necessary. So instead of good or bad, we should just look at it as necessary, and it's hard sometimes. Okay, so just back to the fact that the heart has its own spontaneous contraction. So if anyone's ever taken biology lab, they take out a frog's heart, and you cut it in half, and they're both beating, and you cut them in half, and they're beating, and you cut them in half, and they're beating. Okay, so our voluntary muscle doesn't do that, neither does our smooth muscle do that. Okay, it needs a stimulus. Smooth muscle, and just to give you a little more of the anatomy of it, smooth muscle, striated muscle requires, it's usually connected between two or more joints. Okay, so the bicep begins up here, and it ends here. Can I pull some? Okay. So it goes across. Muscle is connected to bone by a connective tissue called fibrous tissue called tendon. That's what a tendon is. Tendinitis. Okay. The reason tendinitis is so painful is because every time you use that muscle, you've got to move it. So if it's inflamed, which means what? It's healing. Don't move it. Don't move it. Allow it to heal. That's what the body wants to do. The body always wants to heal. It wants to achieve homeostasis. Okay, and pain is saying, wait a minute. I'm out. Now, the connective tissue between two bones is called a ligament. And so the ankle has many bones. And so when someone goes, and the most common is an inversion sprain of the ankle. What happens? You go like that and stretch the ligament. So what should you do? Get up and run? No. Allow it to heal. Okay, so I think the theme from here throughout the end is that the best thing to do about anything is nothing. Don't eat. Don't say that thing you were going to say. Okay. Turns out to work. But anyway, because nature will heal. So, that's tendons, ligaments, muscle, smooth muscle. You've got the nervous system. Now, the nervous system is made up of a central nervous system, a peripheral nervous system, and the autonomic nervous system, which we just went over. Remember, the autonomic nervous system is automatic, involuntary, is sympathetic and parasympathetic, right? Okay. Now, one of the things that we're going to be starting here are ways to rebalance that autonomic nervous system. Very important. I mean, we already discussed all the organs and organ systems that's involved. How important is it? So, we've got, there's hot and cold baths that you go in 1 minute at a time, and there's different things that we're going to set up here soon. So, nervous system has a central nervous system made up of the brain and the spinal cord. Central nervous system because it's in the center of the body, and peripheral nervous systems are all the nerves that come out of the spine. You have the spinal nerve, and it comes out and it allows you to do these things. Okay? And then it's got sensory, which is called afferent, and then it's got motor, which is called efferent. Goes to the spine, goes up to the brain, and then there's a part of the brain that makes connections, brings it into consciousness. Okay. There's a spinal reflex where it doesn't have to go to the brain. And that's the famous knee jerk in the doctor's office. It doesn't go to the brain. Because you have to really work hard not to jerk. You have to consciously do it, otherwise it'll happen. Because it's a spinal reflex. It's an important tool. We need to know that. Because if someone has a lesion in their brain, like they had a stroke, they have no control. In other words, there's a disconnect between here and the spinal cord. You're going to get all kinds of stuff. On the other hand, if they have a spinal cord lesion like poliomyelitis, something that's attacked the spine, you can be flaccid. So just by us being able to see whether or not you slowed down or you're hypertonic or hypotonic allows us to know where the lesion is the spinal cord, is the brain. Okay. So, let me see. This just general overview is just very important. I want to talk to you now a little bit about movement okay, we can edit this, but clearly this is not a 1-hour lecture. I mean, but it could be. We're getting close. I just want to talk about what are we waiting for? What do we have to do next?
15 minutes.
Oh, okay.
Before it's been an hour.
Okay, what time is it now? Well, it's not like there's a lot going on today, so. Okay. I want to talk about the anatomical position. So this is how, when they're, like when we're writing in a chart, we discover something on the body, or we have to define it in terms that are unambiguous. It cannot be, right? Because, why? Because what we're writing has to be read by the next guy. He's got to know exactly where it is, especially if there's going to be surgery. Right? So if I don't define exactly where that is, do you remember that? I don't know if you remember that case. I don't know, maybe 12, 15 years ago now in Florida, where they amputated the wrong leg. Anyway, so, the anatomical position. The basic anatomical position is standing erect, straight up. Okay? Straight up like this, feet apart, and then with the palms upward. That is the anatomic position. That's the standard anatomic position. And everything that is, so we divide the body in planes. Right? The median sagittal plane, which goes right through there, gives you anterior and posterior. Also on a male, the penis is up this way, so that the anterior portion is really the underside, or the ventral side, whereas the other side is the dorsal side, or the posterior side. So in the anatomical position, palms are up, penis is up towards here. I have no idea how they came up with that, but that's the way it is, or why. Okay, so because you think, look at it's counterintuitive. Most of us walk around with our hands like this, and we think of our palms as posterior. They're not. So I think they did that just to separate themselves from the rest, so that they, the way professions do now, right? Doctors will talk in all these words, so you don't know what they're saying, and you think they're really smart. They're not. They just have different language, just like talking to someone from Shanghai. And you're from Yugoslavia, So anyway. So, I wanted to give you that. So the arms are at the sides. Okay, now. When we are talking about a limb, anything that's close to the body, or close to this median, it's called proximal and distal. So my elbow is proximal to my hand. My hand is distal to my elbow. Or my hand is further away than my elbow. My elbow is closer than my hand. Closer to what? Here. So we're talking about the origin of a limb. Okay? Then we have superior, inferior. Superior, inferior just means above it or below it. So, superior to the left nipple. She has a 2 by 4 centimeter mass, which is in the left outer quadrant, 2 centimeters superior and 1 centimeter lateral to the nipple. Okay, what is lateral? If you put a plane right through the middle of the body, that's the median. So anything in that direction is medial, and anything in that direction is lateral. Okay? And that's very important in describing it. So if I've got something that is above the belly button, I'm going to say, but it's above the belly button, and it's a little bit to the right of the belly button, then I'm going to call it superior, 2 centimeters, and lateral, 3 centimeters. Whatever, you know what I mean? So then you'll know exactly where it is. There's no ambiguity. Okay, so superior, medial, lateral, superior, inferior, anterior, posterior. When we talk about the hands, we can say the plantar surface or the dorsal surface. Plantar surface. I'm sorry, palmar. I messed that up. Palmar surface. We talk about the foot, it's the plantar surface and the dorsal surface. So the foot has the so the palm of the foot is the plantar surface. And here it's palmar or dorsal. But the plantar and the palmar surfaces have opposite. One's posterior, one's anterior in the anatomical position. The natural anatomical position. Now, let's just talk about movement for a minute. When a muscle is closing a joint, bringing the, see, a muscle begins, it's called its origin, and its, remember? Origin and its insertion. Origin and insertion. So it originates up here in an exact place where the biceps tendon originates, or its origin. And then its insertion is into the bone here. So its movement is bringing the bones together, closing the angle of the joint. Therefore, it's called flexion. Increasing the angle of the joint. So now back here, my triceps are going to do the opposite. They're connecting over here. They're going to cause me to extend. In other words, widen that angle. Okay? So extension, flexion. Right? Flexion. Extension. Okay? So now, these are all done relative to fixed places. We have a problem with the neck. Because the neck, remember, you're closing an angle. Well, look at this. I close an angle. I close an angle. I close an angle. I close an angle. So what's what? The way we talk about it in the neck is that you have forward flexion, lateral flexion, lateral flexion. And since we're talking about really the spine, and we're going to widen the angle, so this is extension. So when you extend your neck, you go backwards. If you turn it to the right or left, you're doing right lateral, right. So when we do a full exam, we have someone, I say touch your right ear to your shoulder, touch your left ear to your shoulder. And I can say that, there's a normal part of the angle that you should be able to achieve if you have normal movement. If not, we'll say right lateral flexion, 20%. Well, chiropractors will use that a lot because they need to know how to measure improvement. So do orthopedic surgeons. Okay? And then, what else does the neck do? It rotates. Okay, so the neck's got several motions. Okay, now, when we move a body part away from the middle, it's abduction, abduction. When we move a body part towards the middle, it's adduction, adduction. So we abduct and adduct. And you know the word abduct when you take something away from, you abduct a child, you abduct, take. So taking away from the body is the abduction. So we would say that the person has like one of the tests for shoulders is the difference between one of the ways we diagnose what's going on is we see whether or not they can voluntarily abduct, or if they, in other words, they can't lift their arm, so they cannot voluntarily abduct. Then we have completely relaxed it, and involuntary we can. That tells us one thing. That tells us there's not a bone broke, or there's not something anatomical that is preventing it. Right? We know this in the motor unit, the musculoskeletal. It's called passive abduction. So we would say passive abduction within normal limits, unable to go beyond 10 degrees in voluntary abduction. Okay, so anyway, these are the basic terms of anatomy that allow us to go from here forward and talk about it and speak the same language. So what I will do is, next time we meet, give you a test. A written test. And there's no passing or failing. All it is letting you know what you know and what you don't know. And I basically, so it's just all the stuff we talked about. I think that's it. Oh, one other thing, I wanted to talk about so just important. So we're talking about surface anatomy and stuff like that. When we talk about the torso, remember the torso is chest divided by the diaphragm into the divided, and then inferior to the diaphragm is the abdomen and pelvis. Abdomen and pelvis have no clear boundary. Now, what we normally call hips are not hips. It's the iliac crest. It's the wings of the iliac crest. It's not your hips. Your hip is really your hips are your hip joint, which is the femur going into the pelvis. And it's a ball and socket, and it's your hip joint. That's your hip. These are the iliac crests. Okay. Now everything is either on one side or the other, right? Everything is, you've got a right nipple, a left nipple, you've got a right kidney, a left kidney, you've got your liver on the right side. The only structure that is really in the middle that you can call something is what we all have, male and female. It's called the natal cleft. The natal cleft is that separation between your right buttock and your left buttock. It's the natal cleft. So it's it's an anatomical term. It's about surface anatomy, and it's the way it's described in anatomy.